Hello, everyone. I'm Mary Lori Lightfoot. The COVID crisis has impacted all of us, but not in the same way. As we have seen both here in Chicago and across the country, it's our communities of color, namely our African American and Latino communities, that have been borne the brunt of this impact, both in terms of its health and economic consequences, and in the process illuminated the broken and racist system of inequality that has held these same communities in the grip of poverty for generations, not to mention withheld access to healthcare, jobs, and education for generations. The very issues that placed incredible burdens on our families before this crisis have only grown exponentially during this crisis, and thrust into high relief how the issues of equity and opportunity are truly matters of life and death. Even though we happen to be meeting amidst COVID-19, we could just as easily be having this conversation during another moment of hardship. Our task before us now is bringing these circumstances to an end once and for all. And we are seeing why every day with each new case and each new death. Though the issues of systemic racism and inequality didn't start overnight, and they won't end overnight or by the close of this current crisis, they must end. And I want you to know that you have an ally in that effort and the fifth floor of City Hall. The challenges before us are profound, but they will only be solved by working together. And I look forward to working together with all of you in the months and years ahead. With that, I'm proud to turn things over to Kaylah Brathwaite for her conversation with Congresswoman Lauren Underwood and Dr. Mustafa Ali.
Thank you, Mayor Lightfoot, for the amazing introduction. I have Congresswoman Lauren Underwood. She represents the 14th District of Illinois. And I also have Mustafa Santiago Ali. He was formerly a member of the Hip Hop Caucus, and he also helped found the Environmental Justice Office of the EPA as a student. Now they're both amazing movement leaders, so it's an honor to be sitting here both with you. First, I wanted to talk to you, Lauren, about how is your community navigating COVID-19? And if you could talk to us about what your community looks like, that'd be really amazing.
Well, hi, Kayla. So glad to be with you today. I represent a community outside of Chicago. It's half suburban and half rural. And so our experience with COVID has been a little bit split. In the communities that are suburban, we're seeing more cases, a higher death rate in some places. And in our suburban communities, life on the farm hasn't really changed. Our farmers are planting their crops, getting their deliveries and things like that. And so, we've seen a little bit of a different reaction to the stay-at-home orders that our governor put into effect. We've gotten a lot of outreach to our office with people, really interested in navigating the unemployment benefits or the small business loans, and people having some difficulty accessing those things. And then, there's just the experience of parents navigating, helping their kids through all this e-learning that has been a little bit challenging to implement. So it's a time of obviously being in it together and coming together, but it's been tough for a lot of families.
The communities that I work in and work for are communities of color, are lower wealth communities, and are indigenous populations. So in our communities, where we're concerned, many people are scared. Many people are looking for information to make the best decisions that they can for their families. We've often been the sacrifice zones. We've been the places where people put everything they didn't want. We are the medically underserved areas. We're the areas right now where people are asking to be tested. And in many instances, because of being in physician deserts, it makes it really tough to actually first get to a doctor and then to have that doctor give the all clear for you to actually go and get the test. So that makes it very challenging for folks. We are also the folks who are on the front lines. We're the folks who are driving the buses and the subways. We're the folks who are delivering the food. So people are worried. They're scared because, there's been a lot of misinformation. There's been a lack of information. And as you know, information is power. So when you don't have it, it makes it a really difficult situation for you to be able to sort of navigate the craziness, which is the COVID-19 pandemic.
Thank you. Thank you guys for that. And then, so I know we hit on a little bit about how frontline communities are being specifically impacted by COVID-19. Mustafa, if you could talk more about like why or like Black, Indigenous, and other communities of color are experiencing higher rates of death by COVID and higher rates of like neglect by the healthcare system and other like systems.
Sure. So, hopefully folks are now aware. Before, people sometimes didn't have the information, but there's no reason for people not to know that communities of color and lower wealth communities and indigenous lands are the places where the majority of our fossil fuel facilities are located. And we know those fossil fuel facilities are pumping out, tons and tons of pollution inside of these neighborhoods. That's that same pollution also that's warming up our planet and causing many of the impacts that are also happening from climate change. But it has also, over the years, created a number of chronic medical conditions. So you have cancer clusters, you have liver and kidney disease, you have heart disease, you have, even lung diseases like asthma. So in our country right now, one of the reasons that we are so vulnerable is that, we've got 100,000 people who are dying prematurely from air pollution. That's more people are dying from that than are dying from gun violence. And gun violence is a serious issue. That's more people dying from air pollution than are dying from car crashes. And that also is something that we have to, put attention to. And we also have 24 to 25 million people in our country who have asthma and 7 million kids. And unfortunately, it's African American and Latinx folks who are going to the emergency rooms and the ones who are losing their lives. And there's also millions of other folks who are being impacted from pollution. And all of that is making us more vulnerable to the coronavirus. So we have to pay attention. We have to push, our policymakers and politicians to do the right thing. We've got to make sure that our foundations and others are coming together. And there are a number of other things that are going on also. In our country, we got 500,000 people who are homeless, and that's a conservative number. We all know that it's higher than that. So when people tell individuals, that you need to actually, wash your hands using soap and water. Well, if you're homeless and if people aren't thinking critically about your particular sets of needs, where do you go? And in our communities also, we've had a problem with people shutting off water in our communities, sometimes electricity, but the water aspect is super important right now as we're dealing with COVID-19, because once again, if you don't have access to clean water, that makes you so much more vulnerable to actually being infected from the virus. So we got a number of different issues that are going on, along with the fact that, it's really tough for us to be able to get the medical services that are necessary and for it to actually be affordable, which is super important also. And when you don't have that, you create this perfect mix. You place these crosshairs on our communities. And that's the reason that you're seeing across the country 70% of people who are African American dying in this city and 40% in another city. And we won't even talk about what's happening on indigenous lands where there's no testing hardly happening at all.
I would love if you could like dive deep into like how the community of Chicago and the intersections of like the labor industry and Black folks kind of like create some unique conditions for them. And specifically just like if you could dive into the importance of like essential workers in those communities.
Sure, yes. So before I became a member of Congress, I've been working in healthcare for a long time, and I started my career as a nurse. I have a bachelor's in nursing and a master's in nursing. And so we know from the data that public health crises, public health emergencies, disasters often exacerbate existing healthcare and economic disparities. I think that there's a thought throughout the country that everybody can just work from home, and we know that that's just not the case. There are many people whose jobs do not lend themselves to working from home, and so many of them are essential workers. People like nurses and grocery clerks, truck drivers, and and so many people throughout our communities that just cannot do those critically important jobs from the safety and security of their home environment, which means that those workers must have the essential equipment, the personal protective equipment that they need to be able to do their jobs safely. That means the full set for many of our frontline healthcare workers: gloves and gowns and masks and eye shields. And then the personal protective equipment that is essential for everybody else that is out in the community doing their work day in and day out. What we've seen is, since there's been so many shortages, right, we've been cut off largely from our foreign sources of either the raw goods or the completed materials, and a sluggish adaptation of our domestic personal protective equipment supply and production, then, you know, we find ourselves in a circumstance where many individuals are being asked to go to work, put themselves in harm's way, and do their jobs every day without having those necessary items. So we see disease circulating. We've seen a lot of public reporting around the proportion of healthcare workers who are being tested and found positive for COVID-19. We're finding that, at least in my community, there's been in the news how like grocery store clerks have been having really severe disease and some deaths and things like that. And so these frontline healthcare workers are getting sick. Many of them are getting severe illness, and people are dying because they're not necessarily receiving the equipment that they need to protect themselves, their families, and our community from the spread. And so this idea of getting the personal protective equipment into the hands of those essential frontline workers is critically important and can't be overlooked at this stage.
If either of you could really like emphasize the importance of like being plugged into the movement and understanding the nuances like of this pandemic, and the importance of like staying safe and how to like do that in order to like keep all of the communities around us safe and healthy, it'd be more than welcomed.
Yeah, so I mean, I'll start off real quickly. You know, we have to make sure that we're getting accurate information. We got to make sure that we're talking with trusted sources. You know, Cousin Ray Ray and others are good folks, but they're not the ones who necessarily, you know, have the technical skills. You know, they can tell you what's going on around the corner, but we need to be making sure that we're talking with folks, you know, with the Nurses Association and, you know, the Black Doctors Association, so forth and so on, so that we know that we're getting the real information that's necessary. We also got to be real serious about honoring the quarantine, honoring, you know, 6 feet. We are a people, you know, who, you know, we love to be close with each other, and that has been a part of our support and protection over the years. But especially for, you know, communities of color, you know, we've got to understand the seriousness of this moment and the impacts that will happen, you know, to us. And we've got to also make sure we're plugging in with our frontline organizations and building and standing in solidarity with each and every one of those. And we can get through this. We can navigate this. But we also got to be focused on not just this moment, but the future as well. We've got to really be pushing people to shift the paradigm. Actually, we need a new paradigm. You know, we can no longer allow ourselves to be the sacrifice zones. We can no longer allow ourselves to be placed in these medically underserved areas. And we can no longer allow people to manipulate the education system so that we are often placed in the jobs that in many instances place us in very vulnerable positioning. So we have to take this moment to actually get very focused, but also to hold people accountable. And we've got to make sure that these new stimulus dollars that roll out actually help to make real change happen inside of our communities and to move us from surviving to thriving.
So thank you both for sitting here with me and sharing such like amazing and critical information. Happy 50th anniversary of Earth Day. It's been an honor.